All right, you're live.
Live? Okay. Good morning. I'm Debra Loder, dietitian and dietary manager here at Wickenburg Community Hospital. And it's Wednesday, the 13th of May, and I've been asked to talk a bit about diabetes and COVID and how they interact with one another and what some of the complications might be. And so first I'll just kind of go over a little bit about diabetes. So we have three types of diabetes. The type 1 is the childhood onset diabetes, and that's where your pancreas just does not produce insulin. And then type 2 diabetes is when your pancreas is not producing enough insulin, or if your it's not being used. So what insulin does is insulin helps take the sugar out of our blood and put it into the cells so that we can use that sugar or glucose for energy. So with diabetics, it's really important that they be careful when they're around sick people, because diabetes can lower the immune system. It works to cause the immune system to not be strong. So people who have diabetes can get sicker because of their immune system. And also some things happen in the body when one has diabetes, that if there's too much of the buildup of sugar. So it's a pretty scary thing. So first I'll go over a little bit about how we can protect ourselves from COVID. And I know that you've probably all heard this a lot on the TV or on the internet, but I'll just kind of briefly go through things. So we know that COVID spreads rapidly. It can really spread. It can go between your mouth and someone else's nose. So it can be in those droplets that we all spray out when we talk or when we laugh or when we cough or sneeze. So that's why we talk about covering our coughs and covering our sneezes with a tissue or into the elbow so that we're not spreading those droplets. And that's why we're wearing masks, because our mask will help us to not spread those droplets. So what are some of the things that we should do? We should wash our hands a lot. And that's because the virus can live on surfaces, on hard surfaces. So if you have a hard surface that, say someone had just sat down here to talk and they had germs on their hands and they touched it, then I could very easily pick those up. And if I were to touch my face or my eyes or my nose, I could take those germs right to the areas where the virus would enter my body. So that's why we want to wash surfaces a lot with a disinfectant, and that's why we need to be sure that we're washing our hands often so that we're not touching our face with our dirty hands, because even though they look clean, they could very easily have germs on them. So wash your hands a lot. Have I wish I had a bottle of my sanitizer here with me, but have the hand sanitizers available. Have one in your car, have one in your office, have one in your kitchen, so that you can constantly use that. And I know it's harsh and it chaps your hands, and I understand that, but it's really, really good that you do that. So if your hands are getting chapped and raw, when you go to bed at night, be sure that you put on lots and lots of moisturizer so that while you're sleeping, that can be absorbing into your skin so that your hands don't get too sore. So the other thing is, like I said just a minute ago, we can wear our masks, and that helps to reduce the spread of the disease. If I'm wearing a mask, I'm protecting you, and if you're wearing a mask, you're protecting me, because we're not spreading those droplets. And then the other thing is to stay 6 feet apart. So we know that this virus can be out 6 feet, can be spread through that droplet contact. So if we both have masks on and we both stay 6 feet apart, we're really reducing our chances of spreading the disease or of catching the disease. So that's really important. The other thing is to just avoid places where there are crowds. You know, we all have to go out and do grocery store shopping. So if you see an aisle and there's a lot of people in that aisle, go to the next one until that aisle clears out so that you're not in contact. And you know, people are not wearing masks out there, so it's really important that you wear your mask to protect yourself and to protect others. So now about COVID and diabetes. Well, there are some early studies that have shown that about 25% of the people who went to the hospital with severe COVID infection had diabetes. So it's not that someone who has diabetes is more likely to get COVID, but what happens is because of their immune system is compromised, they get worse symptoms and they are sicker. So one reason is that, you know, that high blood sugar is what affects the immune system. So it's really important, if you have diabetes, to be very careful at this time to make sure that your diabetes is controlled. You want to make sure that you eat right, that you take your insulin or your oral medications, that you get some exercise, so that you have your blood glucose under control at this time. There are some studies also showing that that this virus likes to live in that high sugar kind of environment. So it's really important to maintain your blood sugar. The other thing is, if you have diabetes, it's really important for you to be prepared. There has been some speculation about insulin not being available, but as of now, there are no reports of pharmacies being short on insulin. So what you need to do is get as many refills as you can of your oral medications and your insulin, and have those available at home, but also have the foods that you need. The recommendation is to have 2 weeks worth of food at all times, so in the event that you were to get sick, you could be able to take care of yourself at home without leaving or having anyone come in, so that you're not spreading the virus. So if you have diabetes, make sure that you've got 2 weeks worth of the foods, the whole grains, the fruits, the vegetables. If you need to, you can use canned or frozen fruits and vegetables, but if you can have fresh, that's great. Also have those good whole grain things like oatmeal and barley, things that will help you control your blood glucose. Also have available to you your simple carbohydrates that you would need to use in the event that your blood glucose goes down. So we don't want you to just have the good foods. We want you to have those simple carbohydrates, like a can of soda or some hard candy or orange juice, those things that help you get your blood glucose back up if you experience a low. The other thing that happens with this COVID and diabetes is there's been a lot of people who have ketoacidosis and with this disease, and that can lead to sepsis and a lot of complications. So you need to monitor your ketones, monitor your blood glucose more often, monitor your ketones more often, just to make sure that your levels are okay. Then if you do get sick, it's really important for you to call your doctor immediately. If you start having a fever or chills or having a hard time, like you can get confused, that's one of the symptoms. So if you have a cough, especially a dry cough, if you're sneezing a lot, if you have a fever, chills, then you need to call your doctor and see, have your doctor give you some advice and see if you need to get tested. When you call your doctor, please have all of the important information available. Have your blood sugar readings available, have your ketone levels available, have your temperature available to talk to the doctor about. So be prepared when you make that phone call, so that the doctor can really help you to understand what's going on and to seek advice if you need to. The other thing that COVID does is it reduces your appetite. When you are sick with this virus, it seems that people are having a lack of appetite. So that's the reason that you might have some lows. If your appetite is not good and you're not eating enough, you need to really monitor yourself so that you can either adjust your insulin or adjust your carbs and not get those lows and highs. So I think that's about all that I have this morning. I would just leave you with some broad advice, and that is to try to avoid getting COVID. That's the most important thing. The best treatment is to avoid getting the virus. So doing those basic things of hand hygiene, of keeping your environment clean, of wearing a mask, of keeping social distancing, all of those things, remember, will help you to not get the virus, no matter who you are, whether you have diabetes or not. And then also a healthy diet will help with this as well. Eat fruits and vegetables, whether you have diabetes or not. The things like dark colored fruits, vegetables, whole grains, they have those wonderful phytonutrients that we know help build up our immune system. So a good healthy diet is really important right now for everyone. If you have diabetes, it's really important to watch your blood glucose at this time. Make sure that you're staying in tight control of your blood glucose, and just stay healthy out there. So I hope that this has helped. If you have any questions about diabetes and COVID, if you want to talk to a dietitian, I'm available here at the hospital for appointments. You would just call the hospital number and ask for my scheduler, and she can schedule some time with you. I am seeing patients. We maintain social distancing. My desk is over there. My patient sits here, so we can stay far apart. So, if you want to make an appointment, that would be good. If you want to just call and chat for a minute, that would be fine too. Just call the main hospital number and ask for Debra. So I hope you have a really good day and that you stay healthy and you stay safe. And I'll see you next time.